definitely getting younger. There's no question about it. The whole industry is getting younger. You know, as people age, there's more procedures that come into play. For example, in the 20s, even the late teens, you know, breast augment is when things start, and you start getting into the late 20s, early 30s. You're talking about Botox, Restylane, and these types of non-invasive procedures. As we start getting into the 30s, you know, maybe people are seeing their eyes starting to age, certainly by their 40s. In their 50s, then they're starting to see the whole skin envelope starting to show aging. Brows, eyes, face, neck. So everybody sort of ages at a different rate, and genetics play a part too. You know, is the face heavy? Is it thin? You know, all these kind of things play a role. You know, I would say facial work is what I particularly see a lot of, and then various types of liposuction and body work, because there's this huge industry now in bariatric surgery where women and men lose a tremendous amount of weight, you know, 100-200 pounds, and they come in and they are healthier, you know, but the downside is there's all this hanging skin. And that's created a whole new industry that we didn't have 10 years ago. So that's becoming a big part of plastic surgery now, and that is as common for men as females. So I think the most common that I see is face and various degrees of body contouring. Facelifting surgery, again, if it's done in an artistic and a natural way, patients are extremely happy. For a surgeon, though, you have to be extremely careful and extremely competent, because everything shows. You can't cover it up with clothing. So, you know, I get a great amount of satisfaction from that. People that have, for example, enlarged breasts, female breasts, you know, they have a tremendous amount of satisfaction in getting them reduced. Or women going through tummy tucks, tremendous amount of satisfaction. So I think the industry as a whole, and what spurred it so much, is people are very happy doing most procedures. We're seeing, at least in my practice, I'm seeing more and more women who want tummy tucks after they've had their kids. It seems like that has been a huge growth, which means breast work, tummy tuck work. Every surgeon is concerned about risk. We think about it constantly. It goes into our planning. It goes into our care. It goes into our discussion with patients. You know, how much risk are you willing to take? Plastic surgery, cosmetic surgery have inherent risk, and they can be devastating. So one has to really go to a well-qualified surgeon, critically important, and have the doc explain, you know, what the risks are: infection, bleeding, nerve injury, skin distortion, poor healing, skin sloughing, dry eyes. You know, all these type of things are real, and it's a healing process. And the face, for example, has to really settle down. I mean, it's got to, all the swelling has to come out. The tissues have to settle, the skin has to relax again, everything is tight for the real shape to really start coming. Now, we're doing more and more short scar work to reduce scarring. That's a big thing in our field. Is one, maintaining the hairlines naturally, to have less and less scarring, so there's more of a push, at least in my practice, and a lot of cosmetic surgeons practices for short scar techniques opposed to the traditional longer scars if a patient fits in that criteria. And that's why people are getting things done younger, because they can have less scarring. So it's become extremely popular, and I often ask patients to have their spouse come in. They need to hear this. And so risks are a real concern, and us plastic surgeons take it extremely seriously, and it's an honor to operate on someone, and we take it in a very caring, nurturing way. So today we're looking to do a complete facelift, which means the eyebrows, the eyes, upper and lower lids, the cheeks, the face, the lower face, and the neck. Oftentimes, in trying to put it together, we look at a patient and see what they particularly need. Now, all patients don't need a full facelift. It kind of depends on what degree of aging they present with and what their goals are. Janice, who we'll be operating on today, have given me the full artistic expression, if you will, to look at her face and make the decisions that I think that would have the best impact on her, and to make her look natural. What we want to do is have a natural appearing face, not a overstretched, distorted face. So the art of the craft of plastic surgery is to create harmony in the face, have a natural appearing face, and to also meet the goals of the patient. And that's something that can't forget. It's sort of like a joint team effort. Now, Janice, today we're going to do more than just a facelift, because as we age, our face loses volume as well. And sometimes facelifts, as you pull the skin, it flattens the skin. So we're going to put fat back in her face to help the volume that she's lost, and that gives you more curvature. As you age, you lose volume in your lips. Okay, so we're going to add lip enhancement for her. Again, not huge, but we just want some to balance. We're looking to balance things. She has a older chin implant in that we're going to take out and put another chin implant in that will give her a better jawline. She had her nose done years ago. A good job was done, but I think now that we can add some other techniques to further improve that. She's going to also have a TCA peel. The facelift addresses gravitational changes. We're going to also address some of the skin changes and the sun damage issues with a chemical peel. So we're going to be doing quite a bit of work on her, and she's given me the artistic ability to do that.